Now, we're going to talk a little bit about the, the aspiration thing we've been talking about before. So this comes from the vaccine administration site here, Centre for Disease Control. So whole thing's there, great detail, size of the needle, massive amounts of detail. But what caught my eye here was, I've called this don't aspirate, extrapolate. So what they're actually saying here, that the CDC is saying in this long paper here, what they're actually saying is aspiration before injection of vaccines of toxoids, pulling back on the syringe plunger after the needle is inserted before injection is not necessary because no large blood vessels are present in the recommended injection site. Well, that's assuming that everyone's anatomy is the same, which is not, and it's assuming everyone sticks the needle in the right place, which they don't. But this is what really caught me, and the process that includes aspiration might be more painful for infants. So this seems like this was instigated by the CDC because they want to reduce pain for infants with previous vaccination programs. But of course, previous vaccines weren't microparticulates, and these are microparticulates. And we saw when we talked to Dr. Peter from Netherlands, from Netherlands, that these microparticulates, the body recognises them as viral-sized particles and initiates an inflammatory response to them. So this is a different type of virus, a different type of vaccine, completely different type of vaccine, and yet we're carrying on with the same rules, which just seems a bit perverse to me. It has to be said. So maybe I can just show you briefly. Now, this is just a news clip here. I think we've got this now from Cumbria, actually, where I work, and clearly we're watching an experienced clinician at work. I'm just going to play that from the start again because we kind of missed a bit. So here we are. So this is just a young lady here getting vaccinated, asking a few questions. So there she's drawing it up. And in it goes, draw back quickly and inject. Let's watch that again in a bit of slow-mo. So there we go, in. Now watch that. She's drawing back, doesn't see blood, therefore she injects. And this is clearly an experienced clinician giving the vaccine dose. I might even recognise her if she didn't have a mask on, because it's my part of the world. Okay, so there we go. Now I'm just going to read a couple of clips from you. I can't resist these at the moment. It's a bit naughty, but they're just from the things you've put on. So these are direct quotes from you. So Rich, talking about people's experiences with getting vaccinated and asking for aspiration. I then asked her to aspirate the needle and explained I had heard the hypothesis that vaccine fluid getting into the blood and circulating could be associated with adverse events. We agree, Rich, thank you. She, the vaccinator, looked at me like I had two heads and said what I'd heard was a myth. I don't think it's a myth at all, and I've been doing this for injection for 40 years. And of course it needs to circulate. Wrong. 0 out of 10. She's failed. It doesn't need to circulate. The whole point is that it stays in the muscle. Because whether it's the adenovirus vector or whether it's the mRNA vaccine, the whole point is you put it into the muscle. It goes into the muscle cells. Some will go into the lymphatics under the arm for sure. But it's the idea, it's the muscle cells and the immune cells under the arm that actually synthesize the antigen. It does not need to circulate. It's the antibodies that circulate. She's wrong. You know, you almost get the impression that some of the clinicians doing this would have difficulty differentiating between the glutamus maximus and the Olricum process. I mean, you'd almost think that. The Olricum process, of course, is that tip of your elbow just there. Anyway, let's go on. Now, I'm no medic, but I know that it's the antibodies that circulate once your body has started to produce them after the mRNA vaccine It's been produced in the muscle cells, correct, and in the lymphatics as well. But you are quite correct, Rich. So she then said they are not allowed to aspirate, which suggested to me there was no point going through the stress of going to different centres only to be told it's a program-wide effect. It is, unfortunately. We're just that we think it shouldn't be. She then had the nerve to say, in a rather eye-rolling way, "Look, no blood," as she removed the needle. This is utterly unacceptable, which I thought is probably just as well. So what an attitude from a healthcare provider. Really, this is totally unacceptable. We must reach concordance with our patients. We have to have concordance. We have to agree. There has to be ongoing consent here. Monique, my guy at, and I haven't got the nerve to say where it is, but you can look it up in the comments, literally Googled aspiration in front of me. And then said the same thing as that Chips person said, the video you said yesterday. Dear me. So the vaccinator actually had to Google what aspirate meant. I mean, say no more. Okay.